Well, thanks so much, Sanjay, for your kind introduction and your sponsorship of the Hope Award. A special thanks also to Linda Kenny and to everyone at MITS for your amazing support of patients, providers, and institutions. I'm deeply honored to receive this year's Hope Award. The work that we have done is nothing if not a team sport. I feel very fortunate to be at the University of Washington, whose support of sometimes controversial work has really been unflinching. I really am appreciative of our funders, especially AHRQ, who's had a major positive influence on the field, along with other funders, including the National Cancer Institute, the Robert Wood Johnson Foundation, and the Greenwall Foundation. I'm especially grateful for my partnerships with malpractice insurers, including CRICO, COPIC, and Physicians Insurance. These are organizations that really have been key to driving culture change around transparency, and they've shown an admirable willingness to work with pointy-headed academics, so I especially appreciate that. None of this would have been possible without the contributions of numerous outstanding collaborators. A special thanks to my primary collaborator, Michelle Mello, who wrote the nominating letter for this award. There are lots of things that I hope for, but one is that each of you has the opportunity and good fortune to work with such a marvelous colleague. But to any of you scheming to lure Michelle into working on your projects, you'll quickly discover that, contrary to popular opinion, I do have a crabby side. The positive steps that providers, healthcare institutions, and others have taken over the last decade towards greater transparency following medical injuries are clear and worth celebrating. But what I find the most striking is how far we have yet to go. In some ways, I think we've been focused on the wrong barriers, such as fear of litigation, while ignoring the much more challenging obstacles: provider shame and embarrassment after error, lack of provider confidence in their communication skills, and the mixed messages that providers continue to receive from institutions, from insurers, and from peers around disclosure. Messages like, of course you should tell the patient what happened, but don't say that. Our view of the problem has been much too narrow. We have thought of disclosure as a discussion between a patient and a doctor about his or her error without considering the multiple providers and institutions that usually are involved when care does not go well, and how this really complicates the disclosure process. We continue to frame disclosure as a risk management activity rather than emphasizing disclosure's fundamental role in quality and patient safety. And most importantly, we've focused far too much attention on what words to say during disclosures and much less attention on the actions that follow and how disclosure fits into a broader framework for accountability following medical injury. Yet despite these barriers, I've never been more excited about the potential for meaningful change than I am right now. Stakeholders who traditionally have fought pitched battles over tort reform, such as medical associations, malpractice insurers, and plaintiff attorneys, are starting to engage in productive collaboration around new developments, such as disclosure and resolution programs. We all should be reaching out to the broadest group of stakeholders possible, such as regulators, legislators, purchasers, patient advocates, and both plaintiff and defense attorneys, to identify areas where together we can improve the response to medical injury. I believe that the time is right for a radically patient-centered vision of accountability after medical injury. Patients should be able to expect that healthcare institutions and providers will recognize when a patient has experienced an injury, disclose the event to the patient compassionately, and make the patient whole when the harm was reasonably preventable. Patients should also expect that lessons will be learned and shared widely to prevent recurrences. Finally, patients should expect that care will be delivered in an environment where quality is prospectively monitored and problems repaired so that patients can trust that they are in the hands of competent providers working in a safe healthcare system. Achieving this vision will be much more challenging than the work to date, but not only do I hope, I'm really confident that through courageous and innovative action and collaboration, we can turn this vision into reality. Thank you.